Hello fellow nurses, I'm Lance and this is my channel on lectures about nursing concepts and examinations. On this first video, we will talk about test-taking tips and strategies about prioritization between clients in the NCLEX-RN. And sana, kahit papaano makatulong yung gagawin nating video na to sa mga magtitake ng NCLEX. So is this topic really important? Prioritization between clients in the NCLEX-RN. Well, isa lang naman ito sa mga pinaka-importanting concepts na dapat mong aralin dahil kapag nag-take ka ng NCLEX, around 10 to 15 items ang questions about prioritization. And dito sa topic na to, dalawang bagay lang yan. There are questions that will ask you to decide which patient should be given the highest priority or you will have to identify which patient should be your least priority. In simpler terms, kapag hinahanap ang highest priority, hahanapin mo ang sickest patient dun sa mga options. At kapag naman lowest priority, obviously, healthiest naman ang tamang sagot. At usually, ang tanong dito, who will you see first? Who will you attend to first? Who will you phone first? Or who will you assess first? While if you're being asked which patient should be given the lowest priority, the question will usually be, who will you discharge first? This is an example of a question that is asking about the highest priority patient. While on this one, you are tasked to identify the healthiest patient and therefore is ready for discharge. Bago natin i-discuss ang tamang approach sa mga prioritization questions, let us study first the structure of the options. So usually, the option will look like this. It will have the patient's age, the patient's gender, the patient's diagnosis, and a modifier. When prioritizing patients in the NCLEX, the age is not important. Well, of course, if you're answering questions about pediatric nursing, you should always consider the age. But in prioritization, the age is not that significant. For example, a 10-year-old patient is not more valuable than a 50-year-old patient. Neither a 50-year-old patient is more valuable than a 10-year-old patient. Same as with the gender. No matter what your patient's gender is, these patients are all humans and they are all equally important. So we will be left with the diagnosis and the modifier. These are both important, but between the two, the modifier is more important. For example, patient number 1 is a patient with pneumonia. And patient number 2 is a patient with ulnar fracture. With an arm cast. Given these two diagnoses, usually your priority will be the patient with pneumonia. But these questions will always have a modifier. So for example, on patient number 1, the patient is on antibiotics. And has greenish sputum. While on patient number 2, the modifier will be with sudden onset chest pain and difficulty of breathing. Now your priority will be patient number 2 because of the modifier. Or a much simpler example can be a patient with myocardial infarction and a patient with angina pectoris. So this is patient number 1 and patient number 2. So between the two, as a nurse with basic knowledge about nursing, your priority will be the patient with myocardial infarction. But if we will add the modifier, for example, the patient with myocardial infarction has stable blood pressure or vital signs, while the patient with angina pectoris is experiencing an unstable blood pressure. Now, your priority will be the patient with angina pectoris with unstable BP because of the modifier. So now that we know the structure of the options, we can now discuss some basic rules or guides to help you arrive at the correct answer on questions about prioritization in the NCLEX. And these rules will help us draw the line between a high priority patient and a low priority patient. First on the list is the use of the words stable and unstable. Well, that's common sense, right? Even if you are not a nurse, you will know that an unstable patient should be given a higher priority compared to a stable patient. But why do we still miss the correct answers on these questions? Because most of the time, we are unsure of what is stable and unstable. And madalas, kapag yung question naglagay ng word na stable or unstable, your tendency is to argue with the question. So for example, nabasa mo, the patient has stable blood pressure. But this patient has this diagnosis. At mabilis siya mag-deteriorate, so therefore, baka hindi siya stable. Don't do that. Don't overthink. Don't overanalyze. If the NCLEX says that the patient is stable, then the patient is stable. If the NCLEX question says that the patient is unstable, then that patient is unstable. As simple as that. So, patients who are unstable should be given a high priority, while low priority patients are usually the stable patients. And also, there are words that will give you a clue if the patient is stable or unstable. For example, the patient is unstable if the patient is newly diagnosed, newly admitted, or the patient has been admitted less than 24 hours ago. Lastly, if the question says that the patient is not ready for discharge. On the other hand, you can say that the patient is stable if the question says the patient is ready for discharge, was admitted more than 24 hours ago, or the patient is to be discharged. The next rule is to check if the patient is acutely ill or chronically ill. Those patients who are acutely ill obviously should be given a high priority, while those patients who are chronically ill are low priority patients. For example, you're given 3 patients. First patient is a patient with congestive heart failure, a patient with chronic obstructive pulmonary disease, and a patient with an asthmatic attack. So based on this rule, your priority should be the patient who is experiencing an asthmatic attack. But what if all the options are acute? What if all the options are chronic? What do we do? You have to check what organ is involved in the diagnosis or the modifier. And the more vital the organ, the higher the priority. Nandito yung pagkakasunod-sunod ng importance ng mga organs natin. The first one, the most important, is our brain. Next is our lungs. Number 3 is our heart. Number 4, liver. And number 5 is your kidneys. And number 6 is the pancreas and the rest of the body organs. So if all the options are acute or all the options are chronic, you can use this technique in order to prioritize your patient. The next thing that you have to check is the time frame of the patient's surgery. Kung post-op yung pasyente, siya ba ay less than 12 hours post-op or more than 12 hours post-op? Yung mga less than 12 hours post-op patients, high priority yan. At yung mga less than 12 hours post-op patients or any medical surgical condition compared to the 12 hours post-op patient, these patients are considered as low priority patients. So for example, you have a patient with congestive heart failure again, a patient who is 2 hours post appendectomy, and a patient who is 3 days post coronary artery bypass graft. Your priority here should be the patient who is 2 hours post appendectomy based on this rule. But what if we add another surgery here? But what if we add tonsillectomy, craniotomy, or lobectomy on this patient? Which patient should still be your priority? This one, 2 hours post appendectomy. So ang technique dito, my fellow nurses, is not the severity or not the level or not the type of surgery. The time frame should be your focus here when it comes to prioritization. The next factor that you have to consider is the use of general anesthesia or local anesthesia. Patients who use general anesthesia on their surgery should be given a high priority, and those with local or regional anesthesia are considered as stable patients. Therefore, they are of low priority. These patients are also considered unstable within the first 12 hours after the surgery. So, yung naunang rule, yung time frame, ay mas importante kaysa sa ginamit na anesthesia. And the next one, you have to check if the patient is experiencing an unexpected symptom or unexpected symptom. And usually, those unexpected or atypical symptoms, they are high priority patients. And those patients who are manifesting expected symptoms, they are considered as stable. Now, a common trap here is the severity of the symptom or the severity of the pain. Do not prioritize based on the severity of the symptom or the severity of pain. For example, you have a patient who is undergoing MRI. And the other patient is a patient with ankle sprain. And the patient with ankle sprain is complaining of severe pain. And the patient who is having an MRI is complaining about mild abdominal pain. Now, using this rule, our priority should be the patient with mild abdominal pain, because we don't expect a patient who's having an MRI to have a mild abdominal pain. There could be something wrong. So that is this rule. Always check if the patient is manifesting an expected symptom or an unexpected symptom. Pero may mga exceptions tayo sa rule na to. For example, a patient with low blood sugar levels, do not use this rule to a patient with hypoglycemia. Say, for example, your patient has type 2 diabetes mellitus, and you have administered to the patient rapid-acting insulin. Obviously, the patient will experience low blood sugar. Don't use this logic, and don't say, diabetes mellitus patient, I've administered insulin, the patient has not eaten, therefore I'm really expecting that patient to have a low blood sugar, therefore I should not prioritize this patient, because that is expected of the patient. Please don't do that if you want to pass your NCLEX. Another exception to this rule is the patient with severe bleeding. And don't use this logic again. So for example, your patient has hemophilia and the patient is hemorrhaging. Don't say, that patient is hemophilic, therefore I'm expecting that patient to have severe bleeding, therefore I will not prioritize that patient. No, don't do that if you want to pass your NCLEX. The third exception to the rule is a patient with very high fever or hyperpyrexia. Hyperpyrexia can lead to brain damage, kidney damage, or liver damage. The fourth exception to the rule is a hospitalized patient who is pulseless, and breathless. And that is the last tip that I can give you in prioritizing patients in the NCLEX. So that ends our session for today. I hope you learned something. And on our next session, we will try to apply these rules on some actual NCLEX questions. See you next time. Bye.